Hello YouTube, it's me Brittany, and today I'm going to tell you all about my second laser hair treatment that I had last week. But before I do that, I want to thank every single one of you guys that have already subscribed. I love every single one of you guys. Thank you so much. And if you have not subscribed, please go ahead and hit that subscribe button. This is an open line channel. That's the goal of it. I'm still kind of young, only about 5 months old in this channel. But the goal was really to kind of be an open line for you guys to hear kind of what I'm going through as I'm transitioning, and maybe for me to help some of you early baby trans people who are, in your first, second, or third year, or maybe not even out yet. I just kind of want some advice on what it's like, and what it really, from a real person. I mean, not that other girls on here that are doing videos aren't real people. I'm just like, I'm a real person. I'm talking about myself. But anyways, so today, like I said, we're going to talk about my second laser hair treatment that I had last week. If you've been following along, you know that the whole point of me starting this was because I got approved for surgery last year, and then I'm now working on a process to get to surgery. And so before I can have surgery, I have to have all the hair removed from down in that area. And so that's where I'm at right now. I've also learned a couple other new things that I'm going to tell you guys, but first let me just kind of go over, if you watched my first video of reflections for my first treatment, you know that I'm really not expecting anything yet at this point, but I will tell you that I am seeing results. So the whole point of me doing this for my laser hair is because I know that there's been mixed results. I've seen mixed results from a lot of other people, and I just kind of wanted to give you guys what my results are. And so far from two treatments, yes, I'm not seeing like a bunch of the hair not there anymore. However, I am definitely noticing a decrease in the hair growth and how fast it's growing, for sure. I had the treatment last Thursday, and I just shaved today, and it was like it was really hard to tell where the treatment worked, and where it wasn't, but it was definitely noticeable that I wasn't growing nearly as quickly or as fast as I have been growing, in the past. I will tell you that this one was done at 60%. So if you've never done laser hair treatments, so you have 6 to 7 treatments to get it all off of your body or whatever. And sometimes you have to have even more than that. It all depends on you yourself, basically. I'm hoping no more than 7, because I've already dropped about $1,200 on all of this, and that's really a lot of money for me. But if you've never had it, they kind of start you off soft. Like, I think my first treatment was done at 40%. This treatment was done at 60%, and then they work your way up to about 80 and 100. So like, I still have two more treatments before I'll be at 100%. But I'll tell you right now, 60% hurts balls. Like literally it hurts balls, like not just figuratively, literally. But anyways, so I'm not anxious to keep going, but I know that it's something that I definitely need, so I'm not like gonna back out of it. And the way I look at it is, something I learned in high school: pain is temporary. So like, I can kind of get over it. It's basically just like a one quick needle shot, to the skin. And then it hurts for a little bit, and then it kind of goes away. So, but it does definitely hurt when it actually zaps you. I am getting all of my nether region down here done. So just imagine how painful it is in some of the other areas that are not hurting like balls. But anyways, sorry, that's super gross. That's really disappointing of me. But anyways, I also have some surgery news that I wanted to share with you guys. So if you have been following along, you know that my insurance for my job stopped covering SRS surgery last year, due to the fact that the government no longer requires them to have to cover that, and so they basically dropped it from the coverage. Also, my insurance stopped covering as much as my meds last year as well, so my cost for my meds went up about $100 last year. So now I pay $150 every paycheck out of my paychecks for health insurance, and I still pay about $150 for my meds each month, which is kind of disappointing, but I'm not going to complain because I need that stuff and I'm not going to quit doing it. But since my insurance wasn't covered, I tried to look into a couple of other health insurance companies here in the United States that could possibly help me, but they're just going to be way out of my price range. So then I've looked into a couple of other options outside of the country. So I've looked into Montreal, in Canada, and I haven't really heard much back from that yet. So when I do, I'll definitely let you know. And I've also looked into Thailand. So I'm really interested in Thailand, not just because I love to travel, but I know that they're really good at what they do there. So I'm not concerned with having to go out of the country there. And now that I've spoken with a few people there, and I've got a further idea of what's gonna be needed, I actually know kind of what my budget is, and I found a company that will help finance it over there. So the best thing so far that I've learned about working with Thailand on my surgery is that there is an abundant amount of surgeons who can do the surgery. So do your research, find the best one you can. The one that I'm actually speaking to has done over 2,000, so I'm feeling kind of confident. But with that comes costs, and included in those costs are flights and hotels. You have to basically be in Thailand for about 3 to 4 weeks at that time period. The way they explain it to me is you'll get 5 days in the hospital, 5 days, 6 nights in the hospital. Then you'll need to be in a hotel near the hospital for the next at least 2 weeks, so expect to be in the hospital for 3 weeks is what they're saying. However, they do finance it with a down payment, so I don't know all of what that is, but now that I've kind of spoken to them, I do know the entire cost of what an estimated cost at this point of what everything is going to cost me with included flights, because the company that I work with not only covers the surgery, they also cover help with hotels, help with your flights to get there, so make sure you're there at the right time, and help with consultations with the doctor, which I have not had, but I should have a video consultation with the doctor hopefully in the next few months. So so the total cost from what we're looking at estimated is anywhere around $17,000, and that is without health insurance or anything, because it's not actually needed when you go to Thailand, but you're basically paying outright cash for it. So and I have a couple of friends that have gone to Thailand and had surgery, and I've heard nothing but good things from them. That's kind of my surgery update at this point. I don't really know much more than that. We are still kind of in a preliminary stage of when that's going to happen. However, with this company that I have spoken with, and when I know more about them, I will definitely let you guys know about them. I'm still trying to feel them out to make sure that they're legit. But so with this company that I'm working with, once we have everything situated out, they are telling me that it's possible that I could be in by the end of the year. I'm still looking for not during ski season. So it would probably be next April or May for me, because I would want to be able to ski and ride next year. And since the recovery period is almost a total of 3 months before you can really be kind of active again, I don't want to have like surgery in December and then miss all of the powder days on January, February, March, April. I would be sad. But anyways, so that's really kind of everything that I kind of wanted to keep you guys up with on my SRS journey. And if you have any questions, feel free to ask me. Some of you guys have asked me to do some other videos. I'm going to be working on those for sure. I am going to go right back into a really long 12-hour work week, 12-hour work days for like 5 days straight here in a second, so I'll be a little bit quiet for a while. But when I come back, I will definitely get some of that stuff done for you guys. Once again, if you have not subscribed already, please hit that subscribe button. Thanks every single one of you guys for watching. I love every one of you guys. We'll talk to you later. Bye-bye.